I want to just take a moment first to acknowledge the magnitude of the challenges we face. Just looking much broader at the county budget, 2 years ago, balancing the budget required $270 million in reductions. Last June, we needed to trim another $80 million. This past fall, voters approved Measure A, thank you, which helps us avoid $300 million in reductions, but another $200 million in reductions are still necessary at this mid-year. Looking ahead to June, the impacts of H.R. 1 will, of course, be building, and we'll have to confront another $270 million reduction target. Projections for the following year show that we will likely face yet another $500 million in reductions. And in total, this amounts to about $1.6 billion in budget reductions or revenue solutions. So while these numbers literally keep me up at night, I want to acknowledge, James, the prescience you had in starting this dial back several years ago. We saw the economy turning. We saw those years of enormous and exponential growth in property tax revenue slowing down. And frankly, as dire as the situation is right now, I think without the choices we've made over the last couple of years, it would be exponentially worse. As we move through this process, which will still be difficult, it's going to be so important that we keep all stakeholders, patients, clients, service and program recipients, community partners, county employees, and the public clearly and consistently informed about any changes that could affect them. I acknowledge that we, and I certainly am talking about myself, will need to be disciplined and recognize opportunities for reductions that align with our guiding principles without allowing transparency to fall by the wayside. And this, of course, on the administration side, means that we need you to communicate timely, factually, consistently, and openly, not only with the board, but with all employees. We say that they are our trusted partners delivering important services to residents throughout the county, and we have to treat them exactly that way. We can't afford to breach their trust. I do find maybe a small sliver of optimism. The federal and financial landscape we are navigating today will not remain our reality forever. While some of our priority areas will face strain, I think our task is to determine which services can be temporarily constrained, restructured, or slowed while preserving the strongest possible foundation and a clear pathway for restoration and growth when conditions approve. At our, I think at the last board meeting when we talked about the home visiting item, I noted that where funding may be constrained now, keeping a program, just as an example, a program going at some level makes it easier to ramp up more when there's more funding. I do have a couple of specific questions regarding the report. Page 18 offers an overview of 13 major checkpoints in the budget process between February and June, but I didn't see a mention of when the board could expect to see Object 2 information as was directed by the board through the referral that Supervisor Abekoga and I brought in December.
I think we committed to having those out in April.
I expect the report that's produced for the board this year to be detailed to the point that we understand the specific programs and contracts that will be impacted by reductions. And certainly moving forward beyond this year, the expectations should be the same, for the same level of detail to be included in all budget conversations, mid-year review, department budget proposals, as well as the recommended budget. The timeline doesn't mention a start date for budget request for information process. Item 17 states that it begins on May 1st. But I think you did say, James, that we can submit questions earlier.
Certainly, and the board has, even earlier today, made requests for information on things related to the budget. So the board can certainly ask for those at any time.
Great.
But the proposals that'll be brought forward in budget won't be published until May 1st.
With regard to HHS, the report indicates a $42 million operating deficit in the enterprise fund, and that will be covered in part by $35 million from the services and supplies budget. And what is the nature of those services and supplies? What services are being reduced and eliminated, and how might patients be impacted? I have no idea what the impact is. I don't know if it's PPE or...
It is in a number of different line items within our budget. It's not any one specific item. Because what we are trying to do is across the board identify specific savings to balance the budget.
If it was supplies, you could tell me we're not buying any more paper gowns. If it's services, I want to know which services, who will be impacted, and what does this look like at the delivery level?
Line items could include pharmacy supplies, where we're targeting a certain percentage
Sure.
of savings. It may be 1% or 0.5% of the total budget, but we set that up as a target because we believe it's reasonable to achieve.
That's an excellent specific example of supplies.
Yeah.
What might an excellent specific example of a service be?
For example, we are renegotiating all of our physician call contracts within the healthcare system, and we believe that there's some reasonable savings that we can achieve through those renegotiations of those contracts. In our estimate, for example, we're probably looking at about $6.5 million by year end, and ongoing savings of potentially more.
And does that impact healthcare delivery to patients?
No, not at this point in time.
Okay.
Because we are looking for those opportunities where we are not going to impact patient care or services.
Yeah.
It will be a restructuring of some of those service lines for physician coverage. As an example, in the budget proposal, in the mid-year budget proposal, we are adding physicians, P41 physicians, to actually employ some physicians in certain service lines, such as anesthesiology at O'Connor Hospital, hospitalist coverage at Regional Medical Center, and through the hiring of the P41s, we can achieve savings in certain contracts. So it's a multi-pronged strategy relative to cost savings, but also identifying opportunities for potential revenue, because in those situations, we can bill and collect for professional fees on top of that.